Word on Health, the report with its finger on the pulse of popular medicine, with Paul Pennington. Word on Health, for your very best of health. On Your Feet Britain is an annual national activity awareness campaign aimed at encouraging desk-based workers across the UK to reduce sedentary behaviour by incorporating more movement into their workday. The man behind the initiative is Gavin Bradley.
There's a lot of medical evidence relating to sedentary behaviour, but no one was really making it simple. There was no real narrative that anyone could really follow. From then, I got to cahoots with the British Heart Foundation. And heart disease killed my father at the age of 57. I was 70 at the time. And for that very reason, I really connected with it.
Gavin, your campaign's primary goal is to raise awareness about the health risks associated with prolonged sitting, such as disrupted blood sugar levels, reduced metabolic rates, and increased insulin and blood pressure levels, and of course not just the benefits to our physical health, but our mental well-being too.
Taking every opportunity to sit less and move more, we say wiggle it, waggle it, just don't sit on it. Just to break up the whole inertia around sitting, particularly in the workplace, and take on a challenge. What are we going to do in our office today to sit less and move more? Does that mean that all our meetings are going to be standing? Does that mean we're actually going to have walking meetings? Does that mean that we're going to ban the lift and use the stairs? Does that mean we're not allowed to write emails to colleagues who are around the corner from us or whatever? We can actually go up and talk to them. What can we do that will make us aware of the issues around prolonged sitting and the opportunities around bringing in movement into the workplace?
Your focus is on the workplace, but of course 1 in 4 UK workers after the pandemic spend a proportion of their week working from home. How can hybrid workers embrace this campaign?
Well, the first thing to realise is that they've lost 5,000 steps on average, walking around the office, walking to the office, walking to the bus stop. Make sure you're moving around the house as much as you can. Take those opportunities to move, OTMs. Make sure you are moving every hour, at least 5 minutes of every hour where possible. Because that's what we need to do, is to break up the risks, basically, of prolonged sitting.
What would you say to anyone sat at their desk right now who thinks that's all very fine and large, Gavin, but my workload is so heavy, I'm way too busy to get up and to move every hour?
I would say you need to recalibrate, because actually you'll perform better if you do. So the time you don't do that will be time that you will lose in productivity. You will pay the price with poorer health. And that's not a threat. That's just a reality. The gains we get from physical activity of whatever sort, and however minor, are significant. And that is what's been powerful in terms of the evidence base over the last 10 years. Previously, everyone was focusing on the physical activity as opposed to the reducing the sedentary behaviour.
Your campaign is motivating employees to make small changes like standing during phone calls, using stairs more frequently, having standing desks, encouraging walking meetings to improve overall health, boost motivation and enhance concentration among workers, and all the evidence from some highly respected institutions supports this and is available on your website. Just curious, have employers got on board with this?
I would say they've come from 0 10 years ago to maybe 3 or 4. But I mean, a lot understand it, but they're really lost in terms of how to actually embrace it and bring it into culture of a workplace. The provision of standing desk is still not good in the UK. Less than 10% of people have access to a standing desk. And in most cases where people have them, they don't use them. They may well be badly positioned. They may be positioned at the end of a bank, but people feel that they don't have less privacy and they don't really want to stick out. We've actually recently launched what's called an active desk, which is a desk which is really designed for everyone because it has an app in it that you can use from your PC, from your phone or from your watch, and it engages you to set your goals and then nudges you to then change positions throughout the day to break down that inertia. The reality is 95% of people who have a standing desk don't use it for the guided level of 2 hours a day minimum.
My grateful thanks to Gavin Bradley. To find out more, visit our website, wordonhealth.com. That's wordonhealth.com. Word on Health, for your very best of health. This month and every month, the autism community want us all to be more accepting of what they live with, to help overcome the challenges that too many of the 700,000 people across the UK who live with autism have to face. Tim Nichols is from the National Autistic Society.
Our supporters consistently say that improving public understanding of autism is their top priority, and that would have a fantastic impact on their lives. If we're to change how the world sees autism, we need to increase understanding in every sector of society. And and people with autism can get the support they need at the right time. The kinds of support that can include will depend. For a child, it might include speech and language therapy or having learning support within a school. Sometimes it might mean having to go to a specialist school, but a lot of the time it's within mainstream education. And as an adult, people with autism might need support from social services to live independently.
Tim, when it comes to awareness on the plus side, studies have suggested that 99.5% of us have heard of autism, but on the downside, many of those polled struggle to define what it actually is.
Autism is basically a communication disorder that affects how a person sees the world around them and how they communicate with other people. We talk about it as a spectrum condition. That means that while all people with autism share certain areas of difficulty, the condition affects them in different ways. Some people with autism are able to live independent lives, but some others are going to need a lot of support, possibly in a specialist environment.
How might it manifest itself?
The signs and symptoms of autism vary from person to person. So while some people may have a language delay as a child or communication problems as an adult, find it difficult to make friends, for example, they may also find it very difficult to pick up on social rules within a group setting, or they may take things very literally and not make eye contact. And some of these things can go unnoticed, especially whilst a person is at school, where structures like timetables and rules will help them be supported. And then they have a lot of difficulty leaving that school setting where there's much less structure.
It has to be said the National Strategy for Autistic Children, Young People and Adults aims to reduce health and care inequalities, improve early identification and reduce diagnosis waiting times. As you say, getting the right type of support and understanding is key, and we can all play a part in that. There's also a need for more employers to be accepting of the huge potential that people with autism offer. Currently, only 30% of adults with autism are in any type of employment, but I know with simple adjustments they can make excellent employees, and not just in technical roles.
People with autism can bring a wide number of positive attributes to a job: problem-solving skills, attention to detail, reliability, loyalty that employers really value. What is important is that there is the right support there for them to be able to do that, and that might mean training for other staff so they understand autism. It might mean changes to the physical environment, but there are no limits on what jobs people with autism might actually be capable of.
My grateful thanks to Tim Nichols. To find out more, visit our website, wordonhealth.com. That's wordonhealth.com.
Word on Health. For your very best of health.
It's not clear why, but testicular cancer cases, while still relatively rare, have doubled in the last 50 years. It can occur at any age, but is most common in young and middle-aged men between the ages of 15 and 49, the highest incidence being in men aged 25 to 34. When caught early, testicular cancer has a 98% survival rate. Yet research conducted with a representative sample of young and middle-aged men suggests as many as 80% aren't aware of their risk, and only 1 in 4 check themselves regularly. Rob Corns, a male cancer information nurse specialist with the charity Orchid, talks us through the red flag signs and symptoms.
Over 90% of men will first notice a small painless lump which is attached directly to the testicle. About 20% of men may feel some discomfort, aches or pain in the region, but the majority of men it will be a small painless lump that doesn't go away and is attached directly to the testicle.
Rob, men should check their testicles once a month to spot any unusual changes, lumps, swelling or persistent discomfort, and the best time to do a self-examination is after a warm bath or shower, as it's easier to feel any abnormalities. And if you do, I know we fellas are less likely than women to visit a doctor, particularly for issues related to intimate areas, but it really is important, isn't it?
The quicker a potential problem like testicular cancer is identified, the quicker it can be treated and the less treatment potentially that will involve.
Encouraging open conversations about testicular health and radio reports such as this, its hope breaks the stigma surrounding it and normalises routine self-examinations. And we have a detailed breakdown on the wordonhealth.com website that guys can follow. Rob, are there men at heightened risk of testicular cancer?
Family history increased the risks. If a father had testicular cancer, the risk to a son is about 4 or 5 times greater. If a brother had testicular cancer, that risk is about 9 or 10 times greater. We also know that having had testicular cancer previously, there's more likelihood that it can reoccur. Poorly functioning testicles or testicles that aren't maintaining proper function may increase the risk. And having had a history of an undescended testicle, although this can be corrected in childhood using a fairly simple surgical procedure, the risk of testicular cancer is still raised, and men who are perhaps having fertility problems are slightly more at risk.
My grateful thanks to Rob Corns. To find out more, visit our website, wordonhealth.com. That's wordonhealth.com.
Word on Health. For your very best of health.
An ageing and growing population means that more and more people are expected to be diagnosed with breast cancer in the UK in the coming decades. What's incredibly positive is that breast cancer survival has doubled since the 1970s, and now almost 8 in 10 women diagnosed with the disease will survive for at least 10 years. As has been widely publicised, there are steps that can help to reduce the risk, such as not smoking, keeping a healthy weight and cutting down on alcohol. And if it's noticed that anything's not normal in a woman's breasts, it's vital for them to talk to their doctor. However, very recent research shows 2 in 5 women across the UK don't check their breasts regularly for the signs and symptoms of breast cancer. Katie Goford is a clinical nurse specialist from Breast Cancer Now.
If breast cancer is detected early and it's treated quickly, the outcomes are so much better.
Katie, I see when it comes to women checking their breasts, it's recommended that happens at least once a month, ideally a few days after their period if menstruating, and postmenopausal women should pick a regular date each month. Talk me through the approach that women should take to check their breasts.
Give your breasts some TLC, touch, look and check. To examine your breasts all the way up to your collarbone and all the way under your armpit as well, because that's the whole breast area. A lot of people don't realise how much the breast tissue extends, but it is quite a big area that you need to examine. There's not a right or wrong way of examining yourself. It's just touching your breast and knowing what you feel like normally. And at the same time, we would recommend that you stand in front of the mirror with your hands by your side, maybe with your hands on your hips, and then with your hands above your head, so you know what your breasts look like in a normal situation. And that way, by getting used to that, if anything changes, you'll recognise it. So that's the touch and the look side of things. And the C is the checking anything is different. Most of the time when you find a change, it won't be breast cancer, but it's always important to get that checked. And the things that you're looking out for, if you were to notice anything that felt like a lump or any swelling in your breast, in your armpit or up into your collarbone, that would be a reason to get that checked out by your doctor. The same if you notice any changes to your skin. So if you notice that your skin is pulling in, it's looking a bit puckered, or you've got any dimpling that looks a bit like an orange peel, or if you notice any changes to the colour of your skin, so if it's looking red or inflamed.
I understand it's also important to check the nipples.
You'd be looking at the direction that your nipple is. Everybody's nipple points differently. For some people, it's their normal that their nipple points inwards. But if it doesn't normally and it started to do that, that would be a reason to get in touch with your doctors. You'd also need to be aware of any rashes or any crusting around the nipple or any unusual discharge or liquid that was coming from that area.
What about the shape and size of the breasts?
If you were to feel that your breast had changed shape, had got bigger or got smaller, then again, that's something that you should alert your doctor to and go and get checked out.
All women aged 50 up to their 71st birthday are invited for breast screening every 3 years, but data shows around 40% of those who should come forward don't.
We know that when people find their breast cancers on mammograms, often they don't have any other signs or symptoms. So although you might examine yourself, you may not notice any lumps or bumps or any changes that I've just talked about. And it might be something that's so early that it's not detectable by yourself. We know that people are sometimes frightened and they don't want to come forward. They're afraid of what might be found. But if it's caught early, breast cancer can be treated very easily and very well with very good outcomes.
My grateful thanks to Katie Goford. To find out more, visit our website, wordonhealth.com. That's wordonhealth.com.
Word on Health. For your very best of health.
Across the UK, we have over 3 million people who live with or are at risk of disease-related malnutrition, of which around 1.3 million are over the age of 65. Ruth Harvey is a registered dietitian from Tynemouth.
This type of malnutrition often stems from loss of appetite and unplanned weight loss due to an illness. It's either the symptoms of the illness or the treatment that means the person eats less. Another cause can be a person's social circumstances, or it can be that the illness itself means that they burn more energy and their energy requirements are more.
There are a whole range of conditions that can lead to a person being undernourished, as Cardiff-based dietitian Lucy Marland explains.
People that may suffer from a chronic obstructive pulmonary disease, also known as COPD, people who may have been diagnosed with cancer, people who may have a progressive neurological disorder such as dementia or motor neuron disease, or someone who may have had a change in their swallowing ability, so it's going to be affecting their ability to eat, and this is also known as dysphagia. Someone who was maybe admitted to hospital with an acute illness, and we've also got the group which would come under the frailty group, so those older in age, maybe a reduction in mobility, and have also recently been admitted to hospital.
The consequences of disease-related malnutrition shouldn't be underestimated. Dahlia Campbell is a Tayside-based dietitian.
Somebody may not be getting enough energy. They're going to start using up some of their muscle mass. If you lose muscle, you don't have the strength that you need just for daily tasks. But also it can be strength around different muscles. So, for example, the muscles involved in breathing and swallowing and all of those sorts of things. We also see increased risk of infection. And if somebody gets an infection, it takes them a lot longer to recover. If somebody is going into hospital, somebody that's malnourished tends to have a longer stay in hospital. If they have to go through an operation, they can get more risk of complications, or they may take longer to recover. They can develop sores in hospital or at home because they've not got enough muscle mass and enough fat mass. They're more at risk of falls. We know that people with malnutrition tend to go to the GP more frequently as well. So there's a huge impact.
The Malnutrition Pathway Organisation has for over a decade highlighted the need for greater awareness of disease-related malnutrition and to encourage more medical professionals to screen people at risk. Their lead clinician is Anne Holdaway.
I think for GPs and nurses who may be under a lot of pressure in their own surgeries is thinking about when there's a patient in front of you with dementia, a patient in front of you you know has had cancer and cancer treatment, or a frail elderly individual, are they at risk of malnutrition and should I be screening them? So it won't necessarily be screening everybody, but it may be screening those who are vulnerable, which then leads on to a conversation with them about are they eating enough and do they have any concerns about their ability to eat.
Dudley-based community dietitian Victoria Dagnan highlights the telltale signs that loved ones, friends and family can look out for ahead of seeking medical intervention and gaining the support that the affected individual needs.
Ask about someone's appetite, how they're getting on with their shopping and their food preparation, and do they need any help with eating and drinking? Often there are signs of unplanned weight loss. So someone may have loose jewellery, they may have some ill-fitting clothes, they might have lost their interest in food as well. Have conversations with people, listen to their issues around eating and drinking, and help them to get adequate, appropriate advice and support.
My grateful thanks to my guests. To find out more, visit our wordonhealth.com website. That's wordonhealth.com.
Keeping you in touch with the health and lifestyle issues that matter. This is Word on Health with Paul Pennington.